the questions in the answer. Sorry. Yeah, Purvi madam, please.
Yeah. So good afternoon, everybody. And I'll be talking on a slightly different topic, a myriad of variations which exist in manual SICS. SICS has seen a long history. It all began in 1980s when it was recognized about the role of a self-sealing scleral incision followed by the Blumenthal's technique. And then there were lots of variations and the snare came up and FICO fracture and to the current role of 2 millimeter, 2 minute and the smart software based SICS. But if we see in the entire history, one technique has not overtaken any other technique. All of them are parallelly still coexisting with each other, and all of these techniques are well practiced globally. So we understand that there are a lot of variations in the MSICS technique with respect to the technical steps, with respect to the surgeries overall, with respect to the surgeon's preference, and therefore the training programs that exist with MSICS. So therefore we did a study where we analyzed the different MSICS practice patterns across various geographical regions of the globe. And we studied the type of anesthesia and the preferences for each and every step of MSICS. So I'll just share with you all those results to understand this myriad of variations that exist. Through a questionnaire that was floated globally through various media, we received 278 and valid responses which could be analyzed, out of which 68 were from 13 foreign countries and 210 were from different zones of India. So let us see what these variations are. The first and foremost is the incidence with which SICS is practiced. You can see it's almost a pizza pie type of a structure. All the incidences are varying from people doing less than 10% of SICS to people doing 100% of SICS surgery. So it's almost an equitable distribution. Coming to the anesthesia, again there are lots of variations, most common being the peribulbar, but also retrobulbar, topical, parabulbar, that is a posterior long subtenance, subtenance and subconjunctival are also used for MSICS. Coming to the site of surgery, the most common preferred site is superior, followed by the supero-temporal and then the temporal. 9 surgeons are there globally who customize their site according to the toricity that exists. Coming to the various steps of surgery and which you have been discussing in the prior sessions also, superior rectus brittle suture, 93 do not use it anymore, 147 do regularly use it, and I experienced great pleasure in saying that out of those 93, I am one of them who converted to not doing a superior rectus. Conjunctival peritomy, again 11 have converted to a transconjunctival incision without doing a peritomy. Cautery also, there are lots of variations, bipolar, ballpoint, and there are few who do not use any cautery. Whether a capsular rhexis is done first or the tunnel first, again 215 are there who do a rhexis first and 63 is the other way around. I'll not go into all the numerical statistics because of constraints of time, but mainly showing you the variations that exist. Incision again scleral followed by limbal, and there are those who do a clear corneal also. Coming to the shape of the incision, again a myriad of variations exist. The most commonly performed incision is the frown incision, followed by the straight incision and smile incision, and there are others also with back cuts and V-shaped and all those. Coming to the size of the incision, it ranges from 3 millimeter and now of course 2 millimeter. This was done in 2020 early. So it begins from 2 millimeter to 10 millimeter with the commonest size being from 5.5 to 6.5 as we now know. 142 surgeons do consider the toricity while they make their tunnel with respect to the size and shape. 73 just sometimes consider it, and 53 are there who do not take into consideration the toricity. Side ports again, 23 never make any side ports, and out of those who do make, 205 make a single side port while 50 make double side ports. Anterior capsular staining, again irrespective of the type of cataract that exists, 111 always use a dye and 7 never use a dye. Anterior chamber maintainer, again 26 never use, while the others do popularly use the ACM. Again, there is a lot of variation with respect to the hydro procedures also. 2 surgeons do not use any kind of a hydro procedure. There are some who use only dissection, some who use only delineation, and 69 are there who do both the types of procedures. Capsular opening also, the most popular is the rhexis, followed by the can opener and also an envelope variation. The maximum type of variations exist in the technique of the nucleus delivery. You can see there is a myriad of variation. Most popular is the visco expression, followed by the use of vectis, again wire vectis, irrigating vectis, and there is fish hook technique, Blumenthal technique, slide and glide and spatula, everything. Coming to the IOL implantation, 37.1% surgeons do implant premium IOLs in their MSICS. using either injectors, not using injectors, doing viscoimplantation and doing hydroimplantation. Again, coming to the closure also, there are those majority who always suture the scleral tunnel. Only 20 are there who never suture the scleral tunnel. And again, also coming to the conjunctival closure, it is again having lots of variations. Majority just oppose their edges. Some use a cautery, some use a suture. One surgeon uses a glue regularly. And regarding the side port also, some use stromal hydration, 2 always suture their side ports, and 31 just leave it as such. And again, regarding the end, the subconjunctival antibiotic steroid injection, 166 always give, 70 do not give. So there is a lot of global diversity with respect to the MSICS surgery, and it is important to understand all these variations, what variations exist and how they influence the visual and surgical outcomes, so that it can help us to perform better and teach better. Thank you.
Wonderful, madam. Thank you for giving that systematic review of literature. Thank you very much. I next request Dr. Pawan Kumar to please start his presentation. Before that, Purvi madam, apart from doing a do you have Dr. Pawan Kumar here? Okay, so we'll move on to next, understanding the economics of SICS by Dr. Jatinder Bali. Madam, just had one, I was a little curious about is, apart from doing the systematic review of literature, how can't we start the preferences and trends survey? I think it's very well commonly followed. Survey. The recent survey? Acha, recent survey. Okay, great. Wonderful. And are we publishing that in our GS? Wonderful. I hope everybody reads that. It's about the latest preferences and trends.